Unfortunately, we have to report 3 additional deaths at Northwood, and my condolences as well to those families. We now have 51 Nova Scotians who have died of COVID-19. Today, I'm reporting 4 new cases of COVID-19, which brings the total number of confirmed cases in Nova Scotia to 1,024. All 4 of those cases are associated with Northwood. We have again today we have no community-based cases, which is good news. Yesterday, the QEII labs processed 502 tests. We currently have 9 individuals in hospital, 4 of those in the ICU. We have 870 people now who can be considered recovered, and 34,604 people have been tested and have negative results. We continue to have three licensed long-term care homes and unlicensed seniors facilities with active cases of COVID-19. In Northwood has 64 residents and 13 staff with active cases, and 1 other facility has a staff member, and a 3rd facility has 1 resident with an active case of COVID-19. As I say every day, it's still important that Nova Scotians who have symptoms that could suggest they have COVID-19, that we continue to have those people reach out and be tested early on. So if you are positive, we can have rapid follow-up by public health around isolating cases and quarantining contacts. So if you have 2 or more of fever, new or worsening cough, sore throat, runny nose, or headache, if you think you have COVID-19 and have 2 or more of those symptoms, go to the online 811 assessment, and if you don't have internet capacity, then calling 811, and they'll walk you through a further assessment and direct you to testing as necessary. At yesterday's briefing, I addressed some of the questions that the media and the public had about the difference between the numbers of active cases we were reporting provincially and active cases in long-term care. As I explained, that much of this difference was due to the fact that we're using 2 different data sets and different timelines from those data sets. Public health has been actively working diligently since the pandemic. We've been tracking, tens of thousands of test results and hundreds of active cases. We continue to refine our testing processes and doing audits and reconciliations on our data like we do all the time. That in the last 48 hours that we have done a lot of that work with our around recovered cases and been able to reconcile that data. And that's why you'll see today that Northwood's active cases among residents dropped from 157 to 64. So we have a much truer picture of our number of active cases. People may, if they have sharp pencils and do math, they may note that the active cases among staff at Northwood has risen from 8 to 13 today. And that's a result of 5 members that, as we did the review of the long-term care data, that they had been listed as recovered, but their cases were still active, so we've made that correction. I think it points to the complexity of all the data we have, but also that we have an ongoing work around that we do this auditing and validation periodically to make sure that our numbers remain true to and accurate. And so we have that. I just wanted to bring that to people's attention. And as I said, and I noticed yesterday lots of people were doing math. And so we want to make sure that you understand if there's differences in the numbers that you see today.